Namaste and welcome to the next lecture of Clinical Ayurved. Myself, Dr. Mayuresh Agte. I have discussed with you Ratta Pitta and its different dimensions. I hope you like that discussion and understood it thoroughly. Now we will move to the next Ratta Vasodas Vyadi, very common in our practice and very easy as compared to other disease to treat also, and it is the disease is Pandu. Now as far as treatment is concerned, all of us are very aware of Lohokalpa, Sudhamakshi, Abharat, etc. So I will not go in details at present or in today's lecture. So I will discuss those points which are really a different one, or they are my doubts about the Pandu Valley. So let us start with the disease Pandu. In Charak Samhita, it has been noted that it is a Rasavas Vyadi, and the logic behind is given that Rasa is Adya Dhatu. After Rasa, Ratta Dhatu is formed as far as Dhatu Parampara, and that's why when there is Raktakshay, you have to consider it as a Rasava Srotas Vyadi, because Adya Dhatu is Rasa Dhatu and then Rasa Dhatu is formed. Now, my question is, I am not criticizing any text, to be frank. My only question is, if it is logically right, then why we don't consider this logic about other Dhatukshay? For example, in the case of Mamsakshay, we should consider Ratta Dhatu or Ratta Sudus Vyadi. Same for Medakshay, you have to consider Mamsa Dhatu or Mamsa Sudus Vyadi, like that. So, why this logic is told specifically for the Pandu disease is my doubt, first thing. Secondly, when we are treating the patient, do we consider Rasa Dhatu really? We always consider Ratta Dhatu or Lohakalpa or Dravya which are acting on Ratta Vasrotas, and I have hardly seen anyone talking about or thinking about Rasa Dhatu in Chikitsa. So, to be frank, I am again not criticizing this logic of specifically about Pandu, that it is of Rasa Sudus Vyadi, because Rasa Dhatu, after Rasa Dhatu formation, Rasa Dhatu is created, etc. Practically, it is not acceptable, but still we have to give respect to the Samhitas, or maybe I am not able to understand this logic. This may be this may be the right reason. So, in Pandu, we think of Arthadhatu, Rattava Srotas. When you are treating Pandu, always remember that many a times Hetu are neglected. We give Lohakalpa, etc., nothing wrong, but in practice, you have to rule out the Hetu in case of Pandu specially, because in India, the most common Hetu seen in this disease is malnutrition, especially a lower economic class, or because of junk food habits, Ratta Poshak Ahar is neglected, and you will find Pandu in such cases. So, along with the treatment, always think of this malnutrition or bad habits of the food. Second thing, which is very important, that you have to consider if any bleeding is there from any orifice. For example, Ratta Pradar, you will find Pandu. Saratta Arsha, you will find Pandu. Or ulcerative colitis, when there is Saratta Malapravritti, like that, in that case also Pandu comes as a symptom, and hence a patient when comes to you with the symptoms of Pandu, just rule out first आहार, either malnutrition, bad habits, or अति उष्ण तीक्ष्ण लवण रसात्मक आहार like prickles or eating spices etc. So all these food habits and food content are to be considered first to rule out the causative factor. Second, if there is any bleeding conditions present in the body, then in that case you have to think of the Raktastamban first. And third, very important, which is seen in the patient, is chinta. Whatever chinta it is, a family problem, financial problem, professional stress, whatever it is, but I have seen the patients which have a, physically they don't have any problem as such, but this mental stress definitely affects the whole body, but specifically in the pandu it acts as a very major causative factor. So before starting the treatment, just rule out the these common hetus which are often neglected in the practice, and you have to give do's and don'ts to the patient according to the hetu which are found in your patient. So Pandu, Raktamsvatas Vyadhi, these three causative factors. Now, when you rule out these factors as a hetu, then you can go for the Agni, Jatragni or Raktadhatvagni. Both are important in the case of, because there is Raktakshay and you have to make this Rakta Dhatu again to the normal Rakta Vruddhi. For Rakta Vruddhi, both these Agni are to be considered when you are giving the treatment. Of course, this is true about every or any Dhatukshay. Now, a question or homework for you. A patient is in front of you, you have diagnosis as a Pandu, and you have ruled out all the causative factors. You have asked the patient what to be eaten, what to be avoided. Patient mentally is sound, no any stress, no any bleeding conditions. Okay. Now you are starting the treatment for Rakta Vruddhi, and you have two kalpa in front of you. Okay. First is Dhati Loha and another is Navayas Loha. Both are useful in the Pandu. Homework for you is you have Dhati Loha with you, you have Navayas Loha with you, you have Kandada with you, you have Suchakar with you. Okay. How will you choose among these kalpa for the treatment? How will you choose Dhati Loha to be used or Navayas Loha to be used in your patient, and what may be the exact indication of these Loha Kalpa? I have just given example of Dhatri and Navayas. There are many Loha Kalpa. The question is, in which patient which Kalpa, Loha Kalpa will be useful, and how you will decide, on which criteria you will decide how the selection of the Loha Kalpa. We will discuss this in the next lecture. I will be happy to have your opinion on this question or your answer on this question. Thank you very much.